Good morning, everyone. I'm Robert Plitt, and welcome to the 6th of 7 stops of 100 Days of COVID, a coast-to-coast tour across Canada examining how COVID has impacted Canada's cities, how we live, move, work, care, and prosper. This broadcast is originating from Treaty 7 territory, the traditional territory of the Stoney Nakoda, the Sitsuni and Blackfoot Confederacy, and home to many diverse First Nations people from across Turtle Island. Mohkinstsis, the Blackfoot name for the region, is also home to the Métis Nation of Alberta. I'd also like to acknowledge the traditional territories represented by all people joining us on this call and extend a warm welcome to all of you joining us today. Maybe a little bit of housekeeping before we dig in. There's a chat function, and we really want you to use it. But if you do, please direct your comments to panelists and everyone, as we all want to kind of share your thoughts with everyone, as well. A summary of the conversation, including the comments from the chat, will be posted following the session, and the full transcript, including chat content, will be available online. And for those of you who are interested, you can also engage online using hashtag COVID100. So this morning, the Canadian Urban Institute released its first COVID Signpost 100 Days. The report summarizes observations about how Canada's cities have been impacted over the first 100 days of this pandemic. And it's a point in time examination of our state of cities in the COVID era. And it looks at how far we've come and where we must go, and provides a strategic starting point, a key benchmark of the potential impact the pandemic may have in ushering the fundamental changes to how we plan and design our cities, and how we organize the delivery and financing of essential public services going forward. And I think this is really what we're talking about today in many ways, so I want to read that again. The potential impact the pandemic may have in ushering in fundamental changes in how we plan and design our cities, how we organize the delivery and financing of essential public services going forward. It highlights what we do know, but it also makes clear what we do not know, and how that continues to inhibit good policy, leadership, and decision-making, and potentially imperils the future of Canada's economic drivers. I do want to say that, and kudos to CUI for the kind of a rapid response that they have organized around COVID, and it's focused on cities, so I really do want to put a big shout out to them around that. They will be producing 100 every 100 days until this thing no longer is relevant. And so we'll be looking forward to those. So today we're lucky enough to have with us 4 fantastic guests. We have Nneka Otogbolu from the Edmonton Community Foundation. She's the Director of Communications and Equity Strategy. We have Jason Ribeiro from Calgary Economic Development, who is the Director of Strategy. We have Dr. Bill Ghali, the VP of Research from the University of Calgary. And lastly, but not leastly, we have Erin Chrusch, who is a Senior Strategist in the Mayor's Office from the City of Calgary. Sort of the curation of this group is primarily focused on individuals who are working with what one might call anchor institutions. And I think today, the conversation that I want to kind of have is really around our kind of institutions and the kinds of responses that we've been seeing and that we can expect to see moving forward. And what are some of the kind of the key things that that we're going to be responding to. So to the 4 of you, welcome, and thanks so much for joining us and offering to share your perspectives on these last 100 days and where we may be going in the next 100 days and beyond. The public health crisis has revealed the many ways in which our current social safety nets, civic institutions, and infrastructure are not designed for the scale of this crisis, affecting already marginalized communities and intensifying existing inequalities, disproportionately affecting women, older people, Indigenous peoples, and Black and other racialized groups. But I want to say that on the other side of this crisis, it's also revealed the capacity for swift action by our public and private institutions, by our businesses, and by everyday residents to mobilize resources and to collaborate to meet the needs of the Canadian crisis. And so I really want to kind of build off of this kind of juxtaposition. We have historical existing vulnerabilities that are being amplified. And at the same time, we're seeing our civic institutions that in many ways, I wouldn't say across the board, historically can demonstrate some sense of inertia around change. And so I think what I'd like to do is go to you first, Erin. And then the way we're going to structure this is we're going to go, here's the last 100 days, here's the next 100 days, and then beyond. So Erin, Calgary was the first government in Canada to declare a state of emergency just 4 days after the WHO declared it a pandemic. That was pretty bold, I think. And so I think there's something behind that. We'd love to understand the culture of the city and how it was able to kind of make a decision that kind of rapidly. So I'm wondering if you can just take us through the journey that the city has been on over the last 100 days and maybe with a little bit of emphasis on some of the key vulnerabilities that you've been sort of managing.
Sure. First, I want to thank you for inviting me to be part of this panel this afternoon. I'm really looking forward to a very engaging discussion. With respect to why Calgary would have acted perhaps a bit sooner than other municipalities, we called it intentional overreaction. That was the guiding, I don't know if you'd call that a principle or whatnot, but that was the term that we gave to our response. We wanted it to be one of intentional overreaction in terms of being able to flatten the curve so that however we came out of it, we would rather have had people said you did too much than you didn't do enough. So that was the thinking behind why we wanted to act so swiftly. We are very fortunate here that the Calgary Emergency Management Agency, under the leadership of Chief Tom Sampson, we couldn't really ask for a better set of that team deserves a lot of credit for the way that they helped steward us through. And then things happened really, really fast. So I remember coming into work on March 12th. I had a meeting at lunch. We had a team meeting. And then I got back from my meeting and said, yeah, so our team meeting is everybody's going home. It's like, okay. So, so starting quite soon after that, within 2 weeks, we had 6,500 people working from home with respect to City of Calgary employees. We developed a new governance structure essentially that put in place 4 task forces to respond to some of the, as you put it, the vulnerabilities, the issues we were seeing emerge. One specifically, business sector support. We knew that that was going to be an issue as the province moved to implement guidelines that would close businesses and put restrictions on how many people restaurants could serve. And then once they were closed entirely, hairdressers, movie theaters, gyms, all of those kinds of things, that impacted our small business community here quite intensely. And so we needed to do something to respond. So we put that task force in place. Another one with community services, because when your advice is to stay home, that doesn't mean a lot if you don't have a home to go to as well. Staying home isn't necessarily a safe place for everybody. So we needed to respond to be able to see how we could manage that. And then there was one dealing with employee supports to provide that support for our employees as they're working from home and managing challenges, and then an economic resilience task force. So that one, because Calgary's not just dealing with the pandemic right now, we're just coming out of a downturn. Oil prices crashed even further right at the very beginning. Saudi Arabia and Russia decided to enter into a price war. So it was just one thing on top of another. So we've put in place the long-term, a group of individuals from throughout the community that will help guide us to resiliency in the future. And we've developed an advocacy plan to help with working with the other levels of government to determine how best to deal with some of these vulnerabilities. Because, for example, the housing one, which is, like I said, that became quite apparent. How do you tell people who don't have a home that that's where they should stay? And particularly as more and more public spaces where they would otherwise gather became closed off with them, we knew that that was something that we had to respond to. And so, as often happens, the municipality has to fill the gap where other orders of government do not. Something had to be done, and we couldn't wait. So going back to what you were saying about how that kind of urgency, we needed to act. And so we were able to work to set up a temporary shelter for people. And now, you're almost through that. And then what happens is you have to start preparing for the relaunch and what that means for people. How do you get people back to business and keeping your citizens safe? All of this while still providing water, garbage collection, your basic utilities that people come to rely on you for. None of that stopped, even though our business operations were quite impacted by some of the guidelines put in place.
Thanks, Erin. Yeah, it's I think understanding the complexity of is it 14,000 employees?
Yeah, yes, 14,000 plus seasonal workers.
And so and when we get to Bill, we're going to be kind of recognizing a similar challenge, which was extremely large institution that both had to respond at an operational level, but then also at a strategic level in terms of how the role that it plays in the response and the recovery. So thanks for that. Over to you, Nneka. The Community Foundation is a kind of an anchor in the community support system in Edmonton, and quite frankly in communities across the country. There's 191 community foundations with net assets of over $5 billion. And so, and in particular, you do focus on kind of marginalized and vulnerable communities. Yeah. And so you're sort of in the eye of the storm there, and would love to hear from you about your last 100 days and what you've been both doing and the sort of patterns of challenges and opportunities that you see emerging.
Thank you, Robert. Thanks for having me here. So for the purpose of this discussion, I'm going to be using the term equity-seeking communities. And this will include groups that are marginalized by societal structures. Equity-seeking communities often experience social and financial disadvantages as a result of system of oppression. And this oppression could take many forms, which is included but not limited to racism, sexism, and ableism. So for my narration and discussion, the examples of equity-seeking communities would include Indigenous people, ethnic or linguistic minorities, sexual and gender minorities, and people with mental illness or physical and intellectual disabilities. For us at ECF, we understood the need to respond rapidly. So on the 25th of March, we established a COVID-19 Rapid Response Fund. And its purpose was to address the immediate needs of Edmontonians charitable sector. And also, and so far we've provided about $1.3 million to these organizations. The trends we noticed was based on the kind of requests we were receiving from organizations that were serving the equity-seeking communities we had in Edmonton. One of the very important trends we observed was the need for these charities to adapt essential programming to digital platforms. Now the city shut down and these organizations were serving members of these communities. So we had about 450 deaf Edmontonians being able to receive important information about COVID and how to best care for their families through an organization called Connect Center. We also helped the Brain Care Center provide online support to over 450 of its clients living with acquired brain injuries. Another trend we observed was something most of us take for granted. That's access to computers and internet access. Remember, most people that live below the poverty line actually rely on public spaces to get access to internet, like the libraries, but they were all shut down. So how were this marginalized population able to cope within the COVID? We were able to respond rapidly to this, and one of our first grants was to partner with the United Way All In for Youth program, where we were able to provide about 420 laptops to socially vulnerable families. A lot of all the grants we have given, there are dozens and dozens of grants we've given, and they can be found on our website as well. And the stories behind the end users and the organizations that this funding were able to support. We sent laptops and tablets to our neighbors in the Nneka Otogbolu Nation to help people stay connected to families and on and off the reserve. Another trend we observed with the equity-seeking community here in Edmonton was the increase in the need for mental health support. And one of our grants was to the Mental Health Foundation, where they launched an initiative called the Text for Hope. And through the Text for Hope, we've provided 50,000 Albertans to access mental health support. We also observed that seniors were particularly vulnerable to isolation during this time. And so through the RRF, we're able to provide over $68,000 to multiple organizations to address this. Another trend we observed was food safety, food security. A lot of people didn't have access to food, or they were deemed, they were actually part of the community that needed to have access to food. And the John Humphreys Center for Peace and Human Rights was one of the organizations we partnered with to provide about 900 meals per week to vulnerable Edmontonians. The list could go on, but based on food security, we're able to give out grants related to this to the tune of over $380,000. Something else we also observed, which was feedback from some of the organizations we partnered with, was that when the lockdown was announced, we were all told to stay at home, that was supposed to be the safest place for everyone. But we found out that this exposed vulnerable women to domestic violence. And when we got this feedback, we had to mobilize quickly and provide organizations such as the Edmonton Catholic School Foundation with a grant to support families living domestic violence. And most of these funds were put into moving costs, utilities, rent, subsidies, school supplies, and internet connections. We also funded a shelter called the NISA Homes. It's a shelter that helps to provide assistance to women living with domestic violence. So these are some of the trends we observed. There's a long list of them, and we hope to keep, being innovative and getting information and feedback from these organizations we collaborate with to be able to respond in time and solve these problems that are being faced by the equity-seeking communities here in Edmonton. Thank you.
Thanks, Nneka. Yeah, I mean, it's interesting because and certainly the report that was released today echoes what's happening in Edmonton across the country, in cities across the country. And while the report does kind of point out that it's, you know, who you are and where you live is really how you're being impacted by this, it's clear that this is sort of systemic failings in our systems are so endemic and across the country that, and I'm going to come back later to you to really kind of explore more how the community foundations may be working together kind of more broadly as they think about creating more of systemic heft to kind of, you know, eliminate some of these challenges. Jason, over to you. So Calgary Economic Development is kind of tasked with stewarding Calgary's economic strategy. You know, as Erin already pointed out, you know, the economic picture here has been struggling for the last number of years. Take us through this you know, triple whammy, and give us a sense of how the businesses are faring, and some of the actions we've taken to mitigate these impacts.
Yeah, thanks, Robert, and thanks to the CUI and my fellow panelists for framing out this conversation, because I think it's incredibly important. And it's incredibly important for Alberta cities, and specifically to the Calgary lens. You know, Erin touched a bit on this earlier, but we are facing not just a crisis, but a series of crises. And the twin one being, as Erin mentioned, not only the global health pandemic and the increasing amount of cases that we've seen of COVID-19 in Calgary compared to other parts of the province, but also the challenges presented by the global price war on oil. So this has been a devastating impact for the city of Calgary. And to be in economic development, I think at this time is an incredible privilege, because you get to be a part of the solution quite directly, but very daunting. You know, the conference board has indicated that the province as a whole might face an economic contraction of 7%. So when we look at, you know, the last 100 days for us, I quite like the framing that the CUI has used about the signpost. You know, what allows you or provides clues, what allows you to have an understanding about the future and the unknown that it might present. And for us, as you mentioned, that signpost, that guidepost, that roadmap is Calgary and the new economy. It's not just an economic strategy that most economic development agencies around the world would have. It's not just a piece of paper that's overly prescriptive. It is a document and an approach and a strategy that really had responding to the unknown baked into it. And I noticed that one of the sponsors here today for this conversation is Public Sector Digest, and earlier in the year, the economist on my team, Huba Khatun, and I co-wrote a piece for Public Sector Digest called Adaptive Action Planning for an Increasingly Digital Future, Calgary's New Economic Strategy. And in it, it highlighted the process that went into developing this roadmap, or this signpost, if you will. And the core function was of that exercise, the future is unknown. So what can we reasonably predict are going to be drivers of our economy? What are the things that we know we need to focus on? And I can tell you, a crisis like COVID-19 causes a great amount of reflection and a great amount of pause in a number of decision makers. And I think for us as an organization, we really had to sit back and evaluate with our partners, you know, the University of Calgary being one and Erin's office being another, you know, is this the right strategy for now? Is this the strategy that's going to provide help to people? And I'll get into the technical things that we've been doing in a moment, but I think that the vision of Calgary and the new economy was that this become a destination for the world's best entrepreneurs who want to solve really heady global challenges, including cleaner energy, safe and secure food, the efficient movement of goods and people, and better health solutions. And that's since 2018. Here we are facing crashing oil prices. We are facing a global health pandemic. We are experiencing challenges around the world with supply chains and the movement of goods and people being restricted. And as Nneka mentioned, in many of our urban cities, food security is becoming an increasing issue. If this is the hand that we're playing, we're very well positioned to, I think, usher the collective will of businesses, of people, of governments to be able to respond. And I think that's been our focus from an aspirational perspective, but also tactically. And so tactically, the first thing that we did, and I think our offices even closed down before the state of emergency was declared, was information was at a primacy. We have a wonderful manager of business intelligence and research, Nicole, who I want to give a shout out to, but the ability to take in all of this data, all of these forecasts about what is an increasingly challenging situation to wrap your head around was increasingly important as we then advocated and worked with partners in government around the solutions that would best benefit businesses, best benefit people. The second thing is economic development is a very long-term endeavor in many cases, and in most cases it allows you or requires you to be out of market to attract companies, to spread the word about your city. Well, what does that look like when travel is restricted and the global economy has shut down? So we really focused and pivoted towards business retention, focusing on the local community and what businesses needed, whether that be advocacy, whether that be support, whether that be working with partnerships and task forces. Our organization sits with Erin in the city of Calgary and a number of task forces related to business sector support. We definitely turned our focus local. I think the other thing that we tried to do as well is understand what our strengths were, even though, as Erin mentioned, we were coming out of a downturn. We saw unprecedented growth in technology jobs. We were seeing deal flow that hadn't happened, I think, in previous years in emergent industries like the life sciences, like creative industries as well. And so what we wanted to do, I think, was focus on those who were increasingly being left behind in that digital world. So we provided a lot of thought leadership in relation to digital technology with a local company called Shop To It to be able to get local businesses listed on Google, and that was a partnership that we then formalized with the city of Calgary to have that resource be offered to all Calgary businesses. But then the last thing we did was think about tactically what we could do as an economic development agency to help right now. And so we created a job board for Calgarians looking for work, because those in many industries were still hiring at that time. We provided a new marketplace called Connecting YYC to connect businesses and customers to one another. And lastly, we provided a student portal as well for those looking into the summer months, looking for positions. So it has been a very challenging time economically at a macro level and on the ground. But I would be remiss if I did not mention there have been incredible signs of hope in Calgary's economy. Businesses that are pivoting to not only be part of the health response in manufacturing PPE and manufacturing hand sanitizer, but we're also seeing our solutions be championing global perspectives. The work that Bill and his colleagues do is invaluable. The University of Calgary is one of the leading institutions in this global fight, but also, we had a SpaceX launch that it was a Calgary operating board that launched that rocket. Increasingly, we've seen our solutions be part of this global response. So it's been bittersweet. The work is still far, far, and far ahead of us. But it has been the silver lining to see the resiliency of businesses and community members as we look to, I think, rebound from this stronger moving forward.
Thanks, Jason. Yeah, it is, I think the part of this conversation that I wanted to kind of illuminate is kind of the enormous amount of creativity and work that's taking place to actually address these issues. Our next question is going to kind of get about it. Well, what is the role of our institutions in having contributed to the need for us to be able to respond like this, to have those underlying conditions. But for now, we had a bit of a segue over to you, Bill. University of Calgary, 40,000 students.
Over 30,000.
Over
So
30,000 students.
mid-30s.
So obviously, a major employer in the, in the city, significant resources and assets. So clearly, the impact on operations, I'm sure, has been immense. But we'd love to hear a little bit about that. But maybe more significantly, some of the work that the university has been doing is to contribute to the kind of response to the public health crisis outside of the university's operations.
Okay. So just echoing everyone, thank you to the Canadian Urban Institute for hosting this very interesting discussion. And thank you to the three co-panelists. I benefit from getting to go last, and I can pick up all the great things you've each said because the great opening comments. So from my side, I did want to just pick up one thing and say, so I am the Vice President of Research at the University of Calgary, and I have a lens of being part of the executive leadership team of the university that has had to make a whole bunch of decisions about the university, which in a way, I think of Russian dolls. We have a university that resides within Calgary, Alberta, that resides within the province of Alberta, that resides within the country of Canada, that resides within the global community that is dealing with this pandemic. And the Russian dolls is an interesting metaphor because we have policy that comes from all of those levels and evidence that comes from all of those levels and health agencies that provide information on all of those levels. And the decision making is really complicated. And we are like a small city as a university with our 30,000 plus students, our staff. We have fitness facilities, we have sports teams, we have vendors on campus, we have public restrooms, we have parks, so we've had to make a lot of decisions, really analogous on a smaller scale than the city of Calgary, but within the city of Calgary. And there's been so much of the decision making has been about determining, well, what's the evidence that guides decision making at the Russian doll that's one level or two levels above us, and is there consistency in the edicts that come from the levels above us? And that's been quite interesting, and it has brought for me some observations about intergovernmental affairs and governance and public policy that comes from multiple levels, and that's a fascinating thing in and of itself. Prior to becoming Vice President of Research, I was the director of the O'Brien Institute for Public Health at the University of Calgary. I'm a physician myself, internal medicine physician. So over the course of this pandemic, I did look after some patients for a period of time at Foothills Hospital. So saw that side of this pandemic as well. The University of Calgary, as has been mentioned in the comments made, has been very active in addressing the COVID crisis. We have a very vibrant research community that competed very swiftly with some funding competitions that were made possible because of significant federal government investments in addressing the COVID pandemic. So we have researchers that have brought in upward of $10 million of the competitive dollars that are available from the federal government for addressing COVID. And we have done some work that has been done in partnership of relevance to the theme today with the city of Calgary. We've worked very closely with Tom Sampson, the director of CIMA, as well as the mayor's office, and Katie Black, who's the director of community and protective services, in informing the city around various strategies relating to policies for social distancing, closures, regulations. And we have pulled together an expert group that has included experts in epidemiology, statistics, infectious diseases, population health, public policy, and economics. And as well as some individuals who focus in particular on determinants of social vulnerability and how those play out. And Nneka's comments were just so germane to that work that we've done. And then have really looked at the trade-offs that exist between the desire to reduce transmission, economic harm, and limitation to freedoms and enjoyment of life. And there's a real tension between those three. So every single thing does lead to a trade-off in those three dimensions. And we've done some work on how to guide decision making when considering those three axes of impact. I'll close. The Q&A will bring things out, but I did want to just quickly list off 6 quick observations, and these are just spoken as sentences, and then I'll invite some probing on each of these. One high-level observation is that it's much easier to close things up for an incoming pandemic wave than it is to lift restrictions in a re-entry plan. Re-entry is actually more complicated than urgent and quick closure. The second is it's fascinating to think about the multiple levels of government and to look at that intergovernmental relations and the flow of information across levels. A third observation is that decision-making in a dynamic evidence space is difficult. Information has evolved. We were told, oh, there's no evidence of human-to-human transmission in the early days of the pandemic, when clearly there is human-to-human transmission. So that's just one example of how, and I don't point the finger at anybody because science takes time to be conducted. So decision makers need to make decisions without good evidence. And it's been particularly jarring in its importance in this pandemic. The issues of social vulnerability and how social vulnerability puts a spotlight on how societal inequities, you always pay a price. Societies pay a price when there is inequity, and this pandemic has been the great exposure of that. My second last observation is we are in an information age. This is very different than 1918 with the flu pandemic, partially because the virus was different, but also partially because we are so enabled in an information age to learn what's happening around the world and to adapt our strategies. And then the last comment, and I think Jason touched on this, is there is limoncello coming out of this. We've learned a lot about healthcare systems, and the closures have made us realize that, and the way things were managed during closures of many services, that the new health system coming out of this will be different than the one that we went into the pandemic with. And similarly, I think some municipal policies might evolve, and the mayor has spoken of, wouldn't it be great if we use this opportunity to more stably house our homeless residents of Calgary? Wouldn't it be good if we improved the network of social supports because of what we've learned and because of agencies like the ones that Nneka works with and that Erin's team work with? We can have a better social support framework coming out of this. So I'll leave it at that. And
well, that was a great segue. You really handed it off well. So thank you for that, Bill. I'm just kind of doing a time check, and I want to kind of move us on. We're going to build off of that, and Mary had a city talk with Mayor Nenshi last week, where one of the key things he was reflecting on was what is fundamentally going to change as a result of this experience. And he was reflecting on the social contract and the work needed to provide everyone with a kind of life of full potential and dignity. And he spoke really quite empathetically and beautifully to that. And so I think maybe our next kind of question is around like what fundamentally needs to change to enable us to move forward so that these vulnerabilities, these existing systemic failures, we can come out of this and address them. So we can do this a little bit more quickly. I'd like to just open up a conversation around that. Jason, I'm just going to kind of kick it off to you a little bit around, the social contract in relationship to the new economy, but and then jump in. Everybody just kind of jump in. We'll take about 10 minutes, 10, 15 minutes on this, and then we'll kind of move. So this is the next 100 days. Okay, and then we'll move into closing around some of the longer term thinking.
Yeah, thanks, Robert. If she's comfortable, I'm more interested in what Nneka has to say at this moment, right? Like, the focus on equity-seeking communities and the moment we're at socially. If you're comfortable, I would like to just hear what you have to say.
Mute. Okay, great. So what we, as an organization, EDCF, is going to be doing is to still support the immediate needs of the charities that are impacted by COVID-19, but we also want to continue to work to expand our role as a community convener. So what we plan to do is to take our lessons learned so far from our operations and also from the organizations we collaborate with, and use it to establish ECF as a key resource for our community to address future needs, whether it be a second wave of COVID-19 or any natural disaster that might occur. We are also working to establish awareness based on the role of ECF amongst equity-seeking organizations. Part of what we learned so far was that some people or some organizations were stuck. They didn't know who to reach out to or what to request for. For us here at ECF, we don't only give monetary assistance, we also give other forms of assistance. Would it be training? Could it be strategic plans to guide organizations on how to navigate the current situation that we've all found ourselves in? And then we want to use our platform, which is very, very important, to amplify the voices of equity-seeking organizations. We want them to be able to tell their stories through the lenses of the clients they serve or the people they serve. Why this is important is because we want our wider community to learn from the stories. And when they do that, it builds a community where everyone understands what everyone is going through, and we all get to know that we're in this together.
Thanks for that. Like, I think that's, very aptly stated about what the future will look like and where our priorities need to lie. Robert, to your earlier question, one of the other hats I wear is as curator of Global Shapers Calgary, which is an initiative of the World Economic Forum. And with the challenges and strengths that organization presents, one of the interesting opportunities they've brought to the forefront is this idea of the Great Reset, and that the Great Reset will lead to a rewriting of the social contract, which means that, for an organization like theirs, which is bringing together, government and policy leaders and the world's, most influential business minds, that if we want to come out of this stronger, with greater empathy, with greater equity, people need to be at the forefront of every discussion that we're having, be it on the climate, be it on basic and essential needs, be it on technology and the new economy. If you are not placing people at the forefront of any of those conversations, their well-being, their fulfillment, both I think from a financial perspective, but also a mental perspective and purpose-driven perspective, then this might all be for naught. And that's why I think the work that Nneka and particularly Bill's colleagues, as well as Bill, do is incredibly important, because now this has presented this sort of bittersweet but beautiful opportunity for us to recognize the beauty behind the grocery, beauty behind the frontline worker, but also the injustice of the migrant worker and the injustice of those not being adequately compensated. And so for an economic development agency, I think for us, it has put that into the forefront. One of the things that I was most proud to do with my team going forward in January of this year was, under the banner of Calgary and the New Economy, reinforce that a new economy has to be an inclusive one. And so one of the first events that we did under the banner of Calgary and the New Economy was focused on research we had done on the impact of newcomers to our economy. And this is at a time when pre-COVID even, people were talking about Canada's economy and why Canada's economy had not followed other advanced economies into the global recession and global slowdown we had seen. One of the major reasons why was immigration, pure and simple. And so we need to have a very, very thoughtful conversation, I think, about our communities, what they look like, who's advantaged and who's disadvantaged, and what we can do as an overall city, but also even in economic terms in particular, because it's often left behind, how we can make sure that no one is left behind, and that we can take care of those who need our help the most. COVID has expressed, I think, that weakness overall, but it should be our strength if we have a renewed purpose in the next 100 days and beyond.
If I could just jump in there on that, Jason, because if intentional overreaction characterized the city's reaction, I think how I'd characterize the response is build back better. I know I've heard the mayor says that quite often, and even just with what you're saying, COVID exposed those, division probably isn't too harsh of a word here. When you look at the outbreak that, we had a huge outbreak at the meatpacking plant in High River here. At one point, I think it was one of the largest in North America, for epicenters. There's close to, 950 cases from that outbreak alone. And it did disproportionately impact immigrant communities, temporary foreign workers. It brings all of those questions into play. I mean, something that we haven't even touched on at all is that right now you have a number of that same community is dealing with a major natural disaster that happened on Sunday that we believe the massive hailstorm that occurred here on Saturday night hit a part of the city where these people are, it's just, nobody's talking about that, even though according to our numbers, it's probably impacted as much and will have as much of a financial impact as the 2013 floods did. But is it getting any kind of coverage at all? Barely. And so trying to figure out how to address the needs of those communities that are particularly vulnerable, both with dealing with the pandemic and as we try to build back better, is going to be something we really need to focus on.
And then I'll just jump in with just a brief addition just to the question that you framed, Robert, and that's to say that there's no question that I mentioned that re-entry is way more complicated than the abrupt closure of everything, and that's because there is a desire to do what Erin describes, which is to transition initially to a better future state, and I think that there is going to be appropriately a thoughtfulness, but I think even when we get into the longer term postmortem, there will be a need to really look at a number of fundamental choices that we make societally, and these relate, for example, to how much we spend and how we structure care for the elderly. The long-term care sector has really been in the spotlight, and there is going to be a need for inquiries, evaluations. The inquiry should not be the finger pointing, let's find the person or the persons who are responsible, even if individual corporations in the long-term care industry have had disproportionate numbers of cases. I do not think this should be about dragging a particular long-term care vendor out on the sidewalk. That's not what's needed. What's needed is societal questions about how much we want to spend societally, what we want to do to help our most vulnerable populations, the temporary foreign workers program. And there are social justice issues there that require a real consideration. Considerations around health coverage for people who have insecure health coverage. And when you think of the double whammy of losing employer-linked health care insurance just as health insurance is most needed, there's an irony in that, and I think it just exposes some societal choices that we're going to need to make. So I'm optimistic, actually. That's the limoncello. I think a spotlight on these issues is a very positive thing.
Great, thank you, Bill. Thanks, everyone. Just again, aware of the time, and Bill, you kind of handed me just another beautiful kind of segue into our next kind of reflection. The report that CUI put out this morning kind of spoke to the fact that pandemics historically have left a legacy of innovation, kind of a lasting mark on the people and places that have experienced its devastation. And so kind of looking forward, where do we see some of these potential lasting legacies of innovation? So this is beyond re-entry, I guess, and again, thinking about the redesign of our systems and how might this pandemic launch us in some ways to, and I will reread what, I'll try to find it, the first statement, which was how this is going to kind of fundamentally change how we plan and design our cities and how we organize and the delivery and financing of essential public services going forward. I'll throw that out to anyone to.
I'll just make a very short opening statement and I say, what a wonderful time for the Canadian Urban Institute and Evergreen as well, Robert, just to really put a spotlight on healthy cities, smart cities, cities that mitigate social vulnerability, and how can municipal policies be structured in a way that mitigates social vulnerability. I'll just say that for me, being at the University of Calgary and having the tremendous privilege of interacting with our mayor, our general manager here in Calgary of Community and Protective Services, and just reflecting on what the city is trying to achieve for its citizens. I think we have leadership in the city that is really striving for just that. Healthy, smart cities that mitigate more than mitigate social vulnerability, really address it. And I'm filled with optimism because of the mindset that's there. And there has been some writing on the importance of leadership. Many of you may have seen the New York Times story on Bonnie Henry, and how leadership through this time has been so important. And this has really been a time that reveals the importance of committed leadership, human-centric leadership, and this pandemic really exposes that and gives me hope.
Thanks, Bill. Anybody else want to kind of weigh in on that?
You know, just in terms of the, you know, the kind of innovation and going with what Bill was talking about, one of my colleagues, Katie Payton, has been leading an initiative called 9 Block that is bringing together a number of community groups to address social vulnerabilities, particularly in the 9 blocks surrounding City Hall. But it's bringing together, it's not just, you know, the mental health component, it's the planning, like how do we create spaces to address some of the issues that we're seeing here. I mean, that was started well before the pandemic hit, but now, you know, it's seen through that lens, it becomes even more important, going back to what I was saying before about how the you know, whether it's this innovation or just the places, like where the importance of public places, how do we get back to being able to utilize them in a way once they've been closed off. So, you know, and that's being done in conjunction. One of the partners with that is the SAPL, the School of Architecture, Planning and Landscape, University of Calgary, that's right across the street from us now in the old Calgary Library. They've been really key to helping get some of this off the ground. So, you know, I'm just looking at the chat now here and seeing what that Bill is talking about the U of C's involvement with that. You know, so we are seeing that kind of innovation that's addressed, bringing together a number of different partners to meet these needs.
Sure. I'd like to add, in terms of innovation as well, what we've observed is deeper collaboration, like collaborations among organizations that are targeted towards quantifiable and measurable impact and results. So like on May 19th, right? Last month, the government of Canada collaborated with the Community Foundations of Canada, the United Way Centraid, Red Cross to the initiative was called the Emergency Community Response Fund, and their idea was to be able to reach out to the grassroots communities all over Canada through these organizations, because the idea was that the organizations are closer to the grassroots and they knew what the communities needed at that time. So such initiatives and collaboration is part of the innovations that I see that have come out from this experience for us.
Yeah, and I'll just mention in closing, you know, when it comes to innovation, echoing what the other 3 panelists have said, but, you know, one of the things that I you know, think about often is the fact that prior to COVID, you know, work that we had done with the International Data Corporation of Canada showed that Alberta was going to expect and forecasted within the next 2 to 3 years a digital spend of $18.4 billion that was going to descend on our province. And that was not just going to touch the very high-tech sectors, that was going to touch every fundamental aspect of our economy. And so when we think about innovation and building back better, you know, think about, you know, the very real challenge of what that means for a mom and pop retailer with this dramatic increase in e-commerce. Think about what that means for communicating in different ways for folks that don't have the privilege of broadband internet access, as Nneka mentioned earlier. So I think for us, the innovation going forward is to, and I don't, those forecasts may be revised as a result of COVID, but I think these are things that are fundamentally here to stay. And so when we think about innovation going forward and the essential building blocks required, I think one of the interesting things that we can do and leverage is the advantages of technology, seeking to level the playing field for those that don't have access, and really embrace the full affordances, opportunities, but very real challenges that that prospect presents.
Okay, well, thanks to you all. We are sort of at time now. I was going to sort of say one concrete action, but it sounds like there are many concrete actions that we will all be taking. I was also going to suggest that we consider one moonshot, and maybe I'll just pass it over to you, Erin. What might be some of the moonshots that that the city is thinking about right now in terms of how institutionally we can leverage our capacities to eliminate some of these underlying inequities and systemic failures?
We have two major initiatives. I'd say the action on mental health and addiction, and what could come out of that is very exciting for our city. Again, bringing together community partners. In terms of like a one would be going back to what I believe the mayor said last week as well, that if people, if we could give people a home and really being able to address affordable housing through this, I think that's one area where there are definitely a lot of opportunities that we're looking at pursuing, and it doesn't necessarily seem as out of reach as it might have before.
Great. Well, that's a fantastic place to close, to say thank you to Nneka, to Jason, to Bill, and to Erin, to CUI for the tremendous work that they've done over the last 2 months to pull together 3 platforms to create this signpost and to bring tens and tens of thousands of us together to explore these really, really important issues. I guess I will leave with one thought, which is reflecting back on other kind of destabilizing events like the 2008 financial crisis, where that system and the underlying inequities that system built was extremely resilient. And we thought that maybe something would be significantly changed then. So I think we have to be mindful that our systems and our institutions that reinforce the inequities in our systems and the challenges in our cities, they're not going to bend easily. And it's kind of incumbent upon us who work within these institutions to do everything we can to move them along their own journeys of liberation, I guess, from those shackles to make our cities better for everyone. So with that, folks who are tuning in, please move on over to BC. There's going to be a great panel there. I believe you go to COVID100 or COVID100. And if I'm wrong about that, just go to the CUI website and it'll direct you there. Once again, thank you so much. Full of hope and onward.
Thank you all.
Okay. Have a great day. Okay.
Thanks, everyone.